For many of us, our relationship with our GP is incredibly important, sometimes built up over many years. So imagine how it would feel to have a disagreement or misunderstanding with your GP practice and then discover that you and your family have been removed from their list without any warning at all. According to NHS rules, this shouldn't be happening, but here at the Health Service Ombudsman's Office, we see evidence that it is. That's what happened to Miss D and her young baby. Miss D and her family, including her young baby, Baby J, were due to go abroad for a few days. She made an appointment for Baby J to be immunised before the trip. The day before the appointment, the GP practice got in touch and said they wouldn't be able to immunise Baby J because they had miscalculated her age. Miss D had to reschedule her flights. Miss D went along to the next available walk-in clinic at the GP practice, but was told that the nurse was off sick and that no one else was available to immunise Baby J. Miss D was annoyed and upset because the family were due to fly the next day. The GP practice said that she had made an angry remark and deliberately knocked over a vase, which Miss D denied. When she returned from her holiday, she found a letter from the GP practice telling her that her behaviour had been unacceptable and that both she and Baby J were to be removed from the practice's list.
I was shocked and frustrated that they took me off the list without warning. I was given no chance to improve our relationship and felt vulnerable as I felt I was left without a GP. The whole experience with the practice was rather stressful and I struggled to try and speak to someone to resolve it. It was something I would have rather avoided at a time like this with a 7-week-old baby.
Miss D asked us to look into what had happened because she was unhappy with the way the practice had dealt with her complaints. We didn't find fault with the way the GP practice had handled Miss D's complaints, but we did find that in removing Miss D and her baby from their list without any warning, they hadn't followed NHS rules. They hadn't thought about why Miss D was so distressed and how the relationship could be rebuilt, and they also didn't think about Baby J's needs. Following our investigation, the practice apologised to Miss D and paid her compensation of £250. What made this case all the more concerning was that we had investigated a similar complaint about the same practice in 2006. At that time, they told us they would follow the rules in future. This time, we asked them to prepare plans to assure us that this would not happen again. They have since reviewed their procedures and provided training for staff.
I am extremely happy about the way the Ombudsman dealt with my case. The investigation was very thorough and all people I ever spoke to were very professional. I was impressed by the time and care spent not just investigating the case, but also in compiling such a detailed report. Staff were very friendly and helpful every time I spoke to them, and overall my experience with the Ombudsman was 100% positive.
We're here to help. Our service is free to everyone. For information on what we do and how we can help, please get in touch.